This is the curriculum overview for primary care physicians for the AHIMA ICD10 Physician Documentation Specialty-Specific Training Solution powered by the Optimize HIT training software. This ICD10 training solution was built by physicians for physicians, approved by AHIMA's coding experts, and is comprehensive, helping physicians improve their documentation for ICD10 both before and after the ICD10 transition on October 1st, 2014. You can conveniently access this training solution at any time, from any place, and using virtually any device, including an iPad. In fact, no other physician ICD10 training solution is more compatible than the AHIMA ICD10 training solution. AHIMA selected the Optimize HIT training software to exclusively deliver its ICD10 training because of its ability to enable unmatched training targeting for physicians. ICD10 training is targeted to individuals by their role, such as physician, clinical documentation improvement specialist, or coder. Targeting continues with the top 20 to 40 most frequently encountered diagnoses in primary care. And enterprise customers can even target training by their actual diagnosis frequency data by specialty, providing a custom-fit training solution for their doctors. Recognizing that 75% of the information learned in a classroom is forgotten in 7 days, and the very important fact that physicians have no time to waste, the training principles that guided the development of this curriculum aimed at making the training targeted, highly relevant, and high yield. Most of the training is delivered in bite-sized increments, 3 to 5 minutes in length, as opposed to 1 hour long comprehensive modules. Furthermore, information is delivered in bullet points, not pages of text including hours of videos. This makes training easy to consume, easy to start and come back to later, and more fitting into a busy physician's lifestyle. The primary care curriculum is divided into several phases. You are currently in phase 1, where you complete the introductory modules including this one. This should be followed by completion of the diagnosis training skills for the top 20 diagnoses and conditions for your specialty. Phase 2 should be completed closer to the October 2014 ICD-10 transition date. The goal here is to review the initial top 20 and review an additional 15 to 20 diagnosis-specific skills. Phase 1 and 2 should be completed before the transition date and can be reviewed again afterwards as well. Phase 3 is the performance support phase. Through a specialized mobile app, you will have instant access to 30 to 60 seconds of key documentation points for your assigned top diagnoses and many more. You can use this to quickly reference key documentation points after the ICD-10 transition, further reinforcing what you were previously taught. Phase 4 is for enterprise clients that can use the Optimize HIT training platform to deliver targeted training to the individual physician, aimed at helping to improve their ICD-10 documentation in an efficient manner that is protective of their time. They can also use the Optimize HIT training platform to deliver training on their EHR or other related health IT applications, which will very closely align with the needs of successfully documenting in ICD-10. Here's a list of the top 20 diagnoses that might be used for your specialty that will correspond with a diagnosis-specific training skill. These skills should be completed as part of the previously mentioned Phase 1 and 2 of your ICD-10 training program. Each diagnosis-specific training skill follows the same format, beginning with outlining key documentation points for the diagnosis or condition using bullet points, not lengthy paragraphs of text. This is followed by a few example ICD-10 codes. The purpose of displaying the codes is not for you to commit them to memory, only to display how the clinical features of a condition or diagnosis will align with the documentation requirements you just reviewed. The next section is relevant data. This includes guidance on appropriately documenting related information that will support the selection of an additional code that should accompany the code for the primary diagnosis or condition. A common example is appropriately documenting tobacco exposure history when present for primary respiratory diagnoses and conditions. As one can imagine, from a public health and risk adjustment perspective, it is very important to have this relevant data accompany the primary respiratory condition. After the relevant data, you will move into a clinical example with 1 to 2 related quiz questions. Each question will ask you to select one or more components of the documentation that support ICD-10 code selection. After submitting your selections, Each quiz question is followed by a discussion. More importantly than trying to assess your knowledge on ICD-10, the discussion is aimed at continued training, reinforcing earlier taught concepts, and allowing the learner to contrast clinically relevant data from data that will support ICD-10 code selection. Wrong choices typically correspond with clinically important concepts about the diagnosis or condition that won't necessarily impact ICD-10 code selection. At the end, you will be able to preview the ICD-9 and ICD-10 codes selected based on the documentation in the clinical example. The key once again is to remember that coders can only select codes based on your actual documentation, and not by interpreting data found in your documentation, nor incorporating their own clinical judgment. The last screen will provide your results, including your actual score. Please remember that you must get a 100% to successfully complete a skill. You most likely will not get a 100% on all skills your first time around. And should that occur, you can retake your quiz and adjust your choice selection based on the information presented here. Of the 69,000 possible ICD-10 diagnosis codes, your assigned training covering your top 20 to 40 diagnoses will cover hundreds of codes. Despite this, always remember that your focus primarily should be on ICD-10 documentation requirements, not memorization of codes. Also keep in mind that with a mobile app, you will have fingertip access to 30 to 60 second key documentation points on not only your assigned diagnoses, but of hundreds of other diagnoses and conditions, corresponding to thousands of ICD-10 codes. As time progresses, you will find new data associated with your diagnosis-specific training skills, aimed at illustrating why each skill is relevant to the physician and their specialty, and why it is important, including its ability to impact risk adjustments and appropriately characterize your patient's story. This concludes this curriculum overview for primary care physicians for the AHIMA ICD10 Physician Documentation Specialty Specific Training Solution powered by the Optimize HIT training software. Thank you.